You could argue, though, that the reason that the patient has been punished as the recipient of care is the rising copays, the rising deductibles. And you could argue that the reason for that is that much of this is just so complicated and so difficult to manage and so lost in regulatory issues that there's low-hanging fruit. And the low-hanging fruit happens to be the one element in the cost profile that has had the most egregious increase over time, over the last decade. And that comes back to drugs. And so you can see why drugs have been picked and the target, and they're in the center of the target. And so we now have these 4 different tools, more to come. And I thought it'd be good to finally bring them out in the open and talk about them. And maybe with whoever wants to pick one, but I would probably go in the order of which they were released. DrugAbacus came out first, Esco Value Framework second, NCCN Evident Blocks came out third, and now ICER. I'm going to leave ICER to you as the economist.
Oh, good Lord.
But who wants to take the first stab at just giving that quick kind of 1-minute capsule summary? And we'll start with DrugAbacus.
Well,
all right, so let's explain what those little dials are, right?
So the little dials are you looking at the components of basically, and again, this goes to value. So it goes to literally the cost of the drug. Now, I really don't know what the cost of the drug is to MSK.
But the dials are valuing efficacy, toxicity.
Exactly,
right.
And so all those components. The one that he left off, Dr. Bach left off, was the site of service, though. He left off moving that dial, because that dial goes dramatically different in terms of where the site of service. But I don't know, and I haven't spoken to an oncologist that has ever looked at this and said that, number one, they can really figure it out, or number two, that it's useful. And I think the same is true for a patient. So I agree with Mike that I think it was more meant to basically help Dr. Bach on his soapbox of basically that there's a problem with drug prices, and therefore companies need to do something different, and you can compare different drugs. And I really don't know, other than that, how useful the DrugAbacus is.
I don't think it's got to do with the soapbox. I think what it's got to do with is heading towards indication-specific pricing. So determining based on whatever objective criteria are included in the tool, to determine based on the other therapeutic options in that, for that disease or in that class or whatever, what a price that is justified by the best available evidence is. And that's all it is in my mind. It is not designed for doctors to use. It's certainly not designed for patients to access. It's designed for a dialogue, I think, between perhaps payers or Medicare or some other third party with the innovators.
But what's the value there, and especially what's the value there when you basically have one individual or one institution that's sort of determining what some of those inputs are?
Yeah, but that's the way the dials make a difference, right? So you can personalize what your relative
to a degree,
significance is.
Even to a degree.
Yeah.
I mean,
Not
so
all the
they're
dials are
parameters around it.
represented.
Right.
Yeah.
But, so the concept of the dials is that you're going to assign a value, as we talk about value, to each of the components.
Efficacy is the most important thing to me.
Right.
Crank it up.
Right. Crank up efficacy the way.
Right.
Toxicity may be a little bit lower. Innovation is one of the dials, and how innovative is this? How unique a population is it that's being treated with a rare disease? Does that elevate the need, the unmet need, and therefore does it have greater value? So I think there were some merits in the concept, but I agree with you in terms of who uses that tool, where does that tool have value in the healthcare economy? It's unclear.